Good afternoon, everyone. It's hard to believe that we are already halfway through the 2020 year, and the past 6 months have been a whirlwind to say the least. Today it was announced that there was over 1,000 deaths due to COVID-19, and I think we should all remember that that virus is still out there, and we still got to do our job to face the fact that it's out there, again, as I've said many times, along with opening the economy. But we have to take all the safety precautions you can as individuals and everything we can do to help with that situation. We started off this year excited for the future and the direction of Missouri. Throughout my administration, we have been very fortunate to have a booming economy with record low unemployment and high wage growth. And we were looking forward to building on that momentum. We had full intentions of continuing our focus on workforce development and infrastructure, where we were gaining national attention on our positive momentum. We were also committed to investing in public safety, building stronger communities, and improving state government. Needless to say, when COVID-19 hit Missouri in March, everything changed, including our state budget. Today, I sign the fiscal year 2020 budget bills passed by the General Assembly. Although this legislation session was shortened and looked very different, we appreciate their efforts to push through these difficult times and create the 2021 state budget. Like I said, we began this year anticipating strong economic growth, and we based our budget on that growth. But as everyone is well aware of, COVID-19 has severely impacted our economy and our expectations. We could have never imagined this where we would be today, but we've had to face the reality and make some extremely difficult decisions about our budget. For the fiscal year 2020, state revenues are going to finish approximately 7% down from last year. We expect to be almost $1 billion below what we forecast in January. However, my administration proactively set aside savings, including $100 million in budget savings for fiscal year 2020, and we fully intended to do the same in 2021. Unfortunately, this downturn has wiped that out. But if we had not done this, we would have had to restrict even more than we already have. We have to restrict over $430 million in 2020 spending to balance the budget. And we will continue to face budget shortfalls in fiscal year 2021. With that said, we are vetoing 17 items totaling almost $11 million today. In addition to these vetoes, we're restricting over $448 million from the 2020-21 budget to ensure we are financially prepared for this fiscal year. As we adjust our budget projections, we left no agency, division, or program out of a review. These restrictions include nearly 150 items across state government. Today, State Budget Director Dan Hogg is here to provide some more details of the budget restrictions that we've done. So, Dan?
Thank you, Governor. I want to start out by saying that in the 25 years I've been working on state budgets, this is the most difficult budget that I've seen. Revenues declined much quicker and sharper during this downturn than even during the Great Recession. Just to put that in a little bit of perspective, currently the unemployment rate in Missouri is at about 10%. The high point at the Great Recession for the unemployment rate was 9.8%. So we have, in 3 or 4 months, have hit a bottom even lower than what we saw in the Great Recession. In looking at these restrictions that Governor Parson mentioned, we looked at all areas of the budget, We removed almost all new spending from the budget. We looked for ways to become more efficient, and we reduced expense and equipment spending across the board. We are putting these restrictions into place at the beginning of the fiscal year to give our state departments the most time and ability to manage these restrictions in the most responsible way possible. A couple of specific items: both the K-12 foundation formula and higher ed will receive the same amount of funding in fiscal year 21 as they did in fiscal year 20 after the restrictions that were put in place for fiscal year 20. We are currently looking at possible ways to utilize the federal coronavirus relief funds to invest in areas of Missouri that are most critical. And we will plan to start implementing programs and using the funding in the near future. We feel that the amount that we've restricted, $448 million, is sufficient to balance the FY21 budget based on our most current projections. We will monitor revenues throughout the year, and if we feel confident that revenues will finish the year above our current projections, we have the ability to release some of these restrictions. The list of all budget actions will be made publicly available and posted on our budget and planning website.
Thank you, Dan. Let me just say this, too, on the budget process. I know a lot will be said about education. They're two of the largest pools of funding in the state when you have to go to make restrictions on that. I do want to say two things. We've been in contact with DESE, higher education, and community college throughout this entire process for them to know what was coming, that there would be no surprises to that. We tried to keep them informed as much as possible, and I want to thank them for being engaged in that process as we move forward. The other thing I'd like to say, too, when it comes to education, one of the things, education was such a part of our platform for workforce development. And some pieces of that will stay in place because we know to rebuild the economy, we're going to have to continue to build on our workforce development. Since I become governor, we've spent more on public education than we ever have in the state's history before this COVID-19 hit. Because I think that is the future to our state, is to make sure that these kids, whether it's early childhood development, whether it's middle school, whether it's high school, how we move forward as far as training goes and how we get people into the workforce. That's important to me, and I'm just believe in the future. If we work hard, we get the economy back going, we'll get those education dollars back in there so we can move this state forward on that. It's always hard to discuss budget issues, especially during an unprecedented economic downturn like we're experiencing. However, as difficult as these decisions are, we are hopeful that the economy will bounce back quickly and that we may be able to release some of these funds as the year goes on. We are also anticipating in the coming weeks to help offset some of these shortfalls. We will continue to work on workforce development and infrastructure, and I will always maintain discipline to ensure our state's financial stability, just like I have done in the past. I also want to remind everybody the state of Missouri is one of few states in the United States that has a AAA bonding rating. Very few states have that. It's because people over the years in this state have been physically responsible for how they spend the money. No difference whether you have money to spend like you do at home, no difference if you don't have the money to spend. You got to spend within your own means. So I'm proud of our state for all the legislatures, for all they've done over the years to be able to maintain that AAA bonding. Throughout this process, the state treasurer has played an important role in helping us oversee federal funding coming into the state. As a business owner himself, he understands the impact of COVID-19 on our budget and economy, and we appreciate his efforts and leadership in making the most of these funds for all Missourians. Today, Treasurer Fitzpatrick is here to give us an update. Scott?
Thank you, Governor Parson. As Governor Parson and Director Dan Hogg, Budget Director Dan Hogg have outlined, the budgetary impact of COVID-19 is going to be felt broadly across the state of Missouri. While it might not feel like it right now, Missouri is actually in a much stronger position than many states across the country. While the coming fiscal year will now bring tighter budgets, both at the state level and on down, than we'd all hoped for and expected, These changes that the governor is implementing are necessary to meet the constitutional obligation to balance the budget and to allow Missouri to continue to provide necessary services. So I commend the governor for taking the necessary steps in the short term to protect the state's interests in the long term. As many of you know, in April, the federal government provided over $2.4 billion to the state of Missouri in coronavirus relief funds, some of that going to local governments. The governor appointed me to lead a working group that would recommend to him on how to best use those funds. Since that time, the working group has distributed, with the governor's approval, $521 million to Missouri counties. We've also held public working group meetings to discuss ways to ensure the state's prepared and able to respond to any future COVID-19 outbreaks, as well as alleviate the widespread economic impact of the pandemic felt across the state. The working groups heard so far from the Department of Health and Senior Services, the Department of Labor and Industrial Relations, the Department of Economic Development, the Division of Tourism, the Department of Elementary and Secondary Education, the Department of Higher Education and Workforce Development, and the Missouri Chamber of Commerce, as well as representatives from the medical and science communities on topics ranging from testing to remote learning and to business recovery. Additionally, earlier this month, my office held a conference call with over 170 representatives from Missouri counties and municipal governments and a representative from the U.S. Treasury Department to answer questions related to spending CARES Act funds. A recording of that call is available on the COVID website at the Treasurer's office for local government leaders to listen to whenever they need to and for you to access as well. We've heard from county leaders all over the state, commissioners and clerks, as well as local news outlets across the state who reported on the hesitance of local governments to spend their CARES Act funds because of the limited guidance on allowable expenditures from the federal government. While I commend the local government leaders for the care with which they've placed in handling this money, I'm hopeful that the additional guidance that we were able to get through the call that we held with the Treasury Department, as well as the additional guidance coming from various agencies in state government, and the updated FAQs from the Treasury Department are helpful to answer their questions and help get that money down to the front lines where it's most needed. I was grateful to be able to facilitate that call and help guide the conversation in a way that got the needed answers for the counties and other local government leaders. It was very beneficial to the local governments, and it also benefited us at the state level as well. We've had many of the same questions and concerns that they have had. The working group is going to meet again tomorrow, and taking what we've learned from our call with the Treasury Department and additional guidance, as well as a firm knowledge now about what the status of the state budget is, the working group is going to focus on ways to find support for those programs and agencies facing cuts and ways to assist the struggling tourism industry, as well as ways to provide utility assistance for those facing shutoffs, to provide recommendations on those issues to the governor for his consideration. We'll hear from the Office of Administration, the Department of Health and Senior Services, the Department of Social Services, the Department of Agriculture, and the Division of Tourism, among others, tomorrow. I believe there are a number of ways we can offer solutions for those facing cuts, from education to sheltered workshops, and I look forward to finding creative ways to provide that support with the help of the members of the working group, the governor, and his staff. Budget cuts are often difficult, and today is no different. But it's not the end. There's still work to be done, and I'm committed to helping Governor Parson ensure the people of Missouri emerge on the other side of this stronger and that the state is in better financial shape than before. Thank you.
Thank you, Scott. Let me also say, today's not one of those fun days you get up here and do a press briefing. It's much better when you're talking about new businesses and creating new jobs, but the reality of it is these are the true things. These are facts of what's going on in the state, so you have to go up here and talk about the budget in a downturn. But the one thing I think I want to share with everybody too, especially the listening audience today, in the middle of May and the first part of June, we thought this would be worse than what it is today. That goes back to some of the signs of opening up the economy back up. Revenues are coming in a little better than we anticipated. I'm still very cautiously optimistic as we move forward, but those are good signs for our state when we see things like that's occurring. So it's better than what we predicted, and if everybody stays focused and we keep moving forward is a key to that. I think by the third or fourth quarter you'll see a lot of differences in the state. We'll have a good idea where we are financially by then. At that point, I think we'll know whether we can release some of this funding back and hopefully we can do just that. Also, before my closing remarks, Dr. Williams is also here today to be able to answer some questions that I'm sure you'll have today with some of the things going around the state. Again, I just want to mention before I close too, we talked about a lot of things since COVID-19 hit our state, and you know, we crossed the milestone of 1,000 people that lost their lives, and I think it's important for all of us to remember that. Lots of people have lots of different spins they put on everything, but that's 1,000 people that lost their lives due to COVID-19. I think we all need to remember that. A lot of affected people out there, a lot of family members that have been affected by COVID-19 and will continue to be affected by COVID-19 as we move forward. This virus is not going to go away. And I say many times before, you know, we got to do everything we can to make sure one another is safe on that. As we go through the remainder of this week, we will be doing a couple of bill signings this week. On Wednesday, we'll be traveling to St. Peters in southwest Missouri for ceremonial bill signings of Senate Bill 591. We will also be doing some travel on Thursday before our briefing. Again, I want to remind everyone, that we are on the road to recovery. But please continue to be aware of COVID-19. This virus is still here, and we must continue to protect ourselves and others. Social distancing is the key. It's the most important thing we can do is social distancing. If you can't social distance, wear a mask or face covering and take additional precautions. Be proactive, wash your hands, and use common sense. We have to be able to move forward while still protecting public health. Thank you all today, and God bless. Kelly?
All right, thank you. Director Hogg?
Hey, do the reduction, the withholds include any layoffs, furloughs, reductions in pay for state employees?
We don't have any reduction in pays or furloughs. In looking at ways that we can try to be more efficient, and with some of the cuts we have, the restrictions will likely eliminate around 500 positions. Some of those positions will be filled. We think probably around 300 of those positions are likely filled right now. But that's out of a state workforce of over 50,000, so we did certainly try to protect our state employees as much as possible when we put these restrictions together.
Any departments specifically that those are targeted at?
I can get that for you, Kurt. If you want to send me an email, I can get you some numbers.
And what about, how much are you relying on federal dollars? In the budget, I think it was $5.4 billion in spending authority from federal money. Is that still?
In most of the federal funds that we have gotten through the CARES Act cannot be used to help us balance our budget. That's very specific in the federal guidelines. Now, there are some smaller pots of federal money that we can use to help balance the budget. We're using around $150 million of increased Medicaid match, which will help us balance the budget. And then there's various other federal funds where we've been able to find some savings that have helped us balance the budget in various ways. But the vast majority of the money that's come to us, the $2.4 billion that Treasurer Fitzpatrick talked about, cannot be used to help us balance the budget.
Hi, Director. Were the restrictions pretty uniform across the board, like, say, for example, 20% for every department, or how did that kind of vary?
No, we tried to take a more nuanced look at that. We looked at places where we thought we could get more efficient. We looked at new spending. You know, ultimately, you also have to look where the money's spent, as the governor said. K through 12 and higher ed are a very significant portion of our general revenue spending, so we had to look there for some savings. But we tried to take, you know, a more surgical approach to it, trying to figure out ways that would have the least impact. We understand with a downturn of this size, there's going to be impacts, but we tried to come up with the ways that had the least impact. So we didn't just do it across the board.
All right, thank you, Director. Treasurer Fitzpatrick.
Hey, you mentioned the difficulties that some local leaders had said they'd had in terms of figuring out exactly how they could spend the funding and the meeting that you had. Do you know how much of the $521 million has been spent so far?
Well, I don't know that because that information is not in our accounting system. So once we send the money out to the counties, they'll be responsible for reporting. We're still working with OA on exactly the frequency of that reporting, whether it's going to be quarterly, and that's going to be kind of guided by what the feds say relating to the requirements there. But I think the answer is not a lot of it yet. I think most counties were waiting, kind of like the state was, for more information. And I think that the call that we had about a week and a half ago provided a lot of that, and we'll hopefully get some of that money flowing.
All right,
Thanks.
you. Dr. Williams.
Thank you. Just one or two remarks. I find myself kind of in harking back to when I was a surgeon for 30 years, and often when I would operate somebody, especially in the summer, they very quickly would want to know when they could resume normal activity. They wanted to kind of go out and enjoy the warm weather, head to the lake, head to the pool, head wherever. And one of the toughest things was I was glad they felt so good that they could do that, but on the other hand, I had to impress upon them that if they tried too much activity before their stitches dissolved and the body had a chance to heal, they would set themselves back fairly significantly. And so that's kind of where we find ourselves here in Missouri right now as we enter the July 4th holiday. We're incredibly appreciative because of what Missourians have done and with the governor's actions that we're in a position that many people can take part in those kind of activities. But at the same time, we know that, as the governor just said, COVID-19 is still here. The CDC released a report at 2 o'clock today, it was embargoed until 2, that showed 50% of people who get COVID-19 cannot identify where they got it. And so what that tells us is that while you may think, well, gosh, I haven't been around anybody who's coughing or anything like that, 50% of people, when they get an outpatient positive diagnosis, don't know where they got it. So as we go into the 4th, as we say at almost all these press conferences, it is so vital, especially for young people. We're seeing this trend, there's no doubt about it, for 20s and 30-year-olds as they congregate more, that we're seeing more infections. So the pillar of what we've been doing, and the governor just said it, is hand washing. We know that reduces respiratory viruses. Again, social distancing. If you're 6 feet away, this primarily is spread by droplets. And so if you're 6 feet away from people, if you're looking around, and then the third is face mask and face coverings. Well, the more we learn, the more important we realize that is. And so if you find that you're going to be, the rule of thumb I use is that I look around at people around me and go, if that person called me next week and said, I'm positive, would I be obligated to quarantine myself? And so if I'm around somebody and I'm within 6 feet, I put on a face mask. Now, if I'm not, I'm outside and they're 8 feet away, I don't. But if I'm going to be in any situation where I'm in proximity to them and I can't social distance, then I use one, and I've had one on much of the day. So we really, really want to encourage that. And the governor and I are now about 4 months into calls with infectious disease doctors every Saturday morning. I spoke with the Missouri State Medical Association on Saturday morning and spoke with an ECHO group of about 250 doctors on Monday. And I think to a man and woman, they would all highly encourage you to wear a face mask if you can't social distance, and to social distance if you can, and to use good hand washing. So as we go into the 4th, and we're so thankful for what we're celebrating and the chance that here in Missouri we're able to do that, let's not lose ground and let's practice those basic pillars. So Kelly, thank you.
So on Thursday, you mentioned we were at an all-time low for hospitalizations.
Mm-hmm.
I think the day before it was a 30-day high, and then the next day it jumped back up like 160, 170 cases or something. Do you have any idea what's responsible for that fluctuation as kind of the upward trend continues?
Yeah, I think what you're seeing is we're seeing an increase in cases. And so I'll just give you an example down at Freeman and Joplin. We just spoke with them. And as we have we think that you can almost always track those back to a source point, that if you're having an increase in cases, a lagging indicator about 2 to 3 weeks later is going to be hospitalizations. So in Freeman, the CDC, we were on the phone with them on Saturday and Monday and Tuesday. They're down there. We did 2,000 tests this weekend in 4 counties in our community surveys. Very thankful for that. Thankful for the National Guard's help on that. And we'll try to get you those results on Monday from those 2,000 tests in those communities. So as we look at hospitalizations, we know that as that denominator increases of cases, that you're probably going to see the numerator increase, which is hospitalizations. And as you have outbreaks, especially in vulnerable populations, long-term care facilities, you're going to see an increase in hospitalizations.
Hi, Dr. Williams. For every confirmed case, whether it's asymptomatic or not, do you have an estimate of how many other cases are likely out there that haven't been confirmed yet?
Well, you know, the seroprevalence study was just published by the CDC. Missouri is one of 6 states to participate in that. It's very preliminary, and I know some of you have inquired me about that, so if you haven't, we'll most certainly send it to you. And what that is that very early on, I think it was April 20th or so, if you went to the doctor for a cholesterol or a liver panel, then the CDC contracts with a lab, and they drew antibodies on that. And so the number that we've been using was supported by that very early data, which is that I think a reasonable number is that probably at most 5% of Missourians have been exposed to COVID-19, and that's on the high end. Does that answer your question?
Kind of. What I was getting to, how does it affect your testing and boxed-in strategies? If we know there are so many cases that are active, if there are 2 or 3 more out there for every one of those cases, how does that affect the testing and containment strategies?
Well, you know, again, when you say how many other cases out there, one thing, you know, we're always trying to get our R0 to less than 1, which means that when you get to less than 1, they're not infecting anybody else. At 1, they're infecting one other person, and ours is running about 1.1, 1.2. So we would hope, based on that, at this point, those people, for every one you identify, they're only infecting maybe 1.2 other people. And that's how you get the virus eventually to die out. I hope that answers your question, Philip.
I think so.
Kurt?
Your department and some other departments signed a contract, I think within the last couple of days, with Washington University for epidemiology data testing. What's that about, and what's the background on that?
Yeah, Kurt, thanks. They told me that you had called and asked about that, and I'll refer you to Todd Richardson. I think he was in charge of that, and I think he'd be happy to talk with you about that, how they're going to use that data.
Is it an acknowledgement that what the state has in place now is lacking?
No, I don't think so. I mean, we've worked with WashU and the University of Missouri all along, and as the governor has said many times, I think that that's been a real strength of Missouri, is that we've used Missouri data, and we've been involved with WashU since March, I believe. So, but I think a fuller answer will come from Todd, and it's my understanding that they're going to get you in touch with him about that.
Hi, Dr. Williams. How are you?
Good, thank you.
Good. As we're seeing cases rise here in Missouri, but also in other states, we're seeing some states rolling back, some or putting place in more restrictions requiring face masks.
Yeah.
As the director of health, is it wise to roll back some of our restrictions as we head into the July 4th weekend, or is what we have sufficient?
You know, based on what we're seeing at this moment in time, which is Tuesday, June 30th, we think going into the weekend that we don't need to do that. Now, again, we support, if you look at the CDC criteria, you know, they say that if your prevalence is different in different parts of the state or the country, and for instance, if Kansas City feels like they need, because they've had an uptick, need to do things differently, we support that. That's fine. On the other hand, if you have counties where there's a very low prevalence rate and they don't think they need to do that, then we certainly support that as well. But at this moment, but back to my initial comments, I just think it's just really, really important, and y'all play such a big part in this, that we not rest on our laurels and think that if we quit doing what got us here, things will just stay the same. We don't believe that's true. We think we need to keep doing those things that have enabled Missouri to be where we are right now. Don't stop doing them. It would be my message.
What took place at the Lake of the Ozarks during Memorial Day obviously made national news. How do we prevent that from happening heading into another holiday weekend?
Yeah, that's why I'm talking to you right now. I hope you'll do a really good job of publicizing that just because it's July 4th and you're outside to be congregated in a pool, that my message for you today would be 50% of people who get COVID-19 don't know where they got it from. So that if you think you can identify, the data would not support that. And so going into this weekend, even if you're outside, we really, really would encourage you to practice social distancing.
I will take one more, Crystal.
Director, does the governor's announcement on the budget, which starts tomorrow, will that affect the COVID hotline? I'm told that $500,000 were cut from the poison control hotline, which runs it.
Crystal, as I was coming over here, they were briefing me on that, and I haven't had a chance to go through all the details. It was just released at 3, and we just got a preliminary, so I'll have to get back with you on that.
Is it the department's position, though, that you want to continue the hotline?
The COVID hotline and the poison hotline? Mm-hmm. Well, I think that we've seen a marked diminution in calls to the COVID hotline, and so I think, right now we're probably in a time of reassessment. But, when it comes to budgetary things, it's like I always tell people, is that, just like in your life and my life, in a budget you have to look at everything and you have to prioritize. And the very definition of a budget is you don't always get to do everything you want to do. And so I think that's, where Scott and Dan and the governor have such a tough job. They have to look at the whole budget, 16 cabinets, the whole thing, and make hard decisions, and I greatly respect their willingness and their ability to do that. Thank you.
Governor Parson. Glass.
Okay,
Hi, Governor.
Excuse me just a second. Let me make one comment about something. I'll come right back to you. Earlier I know there was some question, I don't know who asked about on pay raises for state employees, if that was in the budget. I think it's important to point out there was a pay raise in the budget for state employees, and now it's taken away. So the effect didn't get a cut, but they didn't get the pay raise they thought they were going to get on that. So I think that's important for state employees. It was a tough environment. I feel like they really deserved that. And I feel like they deserve it after everything they've been through this year, but unfortunately we can't do that. But I want to make sure that was clear that we took away those pay increases for state employees on that. So yes, go ahead.
Okay. Cases among those under the age of 30 are also on the rise, and the national trend is also showing that hospitalizations for that age group are also on the rise, and the concern is that this age group is also carrying it to the more vulnerable. Now, governors of Texas and Florida have closed bars in part because the age group hasn't acted responsibly. Are you foreseeing enacting a similar order here?
I don't at this time. I mean, we feel like right now people out there pretty well know the situation we're in. I think common sense comes here when you see that younger generation. If we want to classify them, they're going to be much more engaged with one another on a closer thing, and maybe they have that little false security that they're okay. But again, I think what you go back to, it's important who are they going to be around, and who do they spread that with. And whether you're at the Lake of the Ozarks there, or whether you're the protesters out in the street, you have the same responsibility to be safe. And if you're going to be in those kind of areas or in places where there's thousands of people gathering or on a daily basis, you're going to spread COVID-19. And that's just what it is.
And when it comes to visitors from other places like Florida, Texas, South Carolina, where cases are really rising a substantial amount, are you possibly thinking about making those visitors from those states quarantine themselves? Is that a part of your thought process right now?
Yeah, I would hope because people would take that upon themselves a little bit, especially if they're coming from a hot spot. But again, I think we're pretty comfortable where we're at as long as we keep watching the dashboards, we keep seeing what the model is for the state of Missouri. And again, I'm not so worried about the positive rate of that number going up. We watch that every day. But you just can't take that rate alone and decide really where we're going with COVID-19. You have to put the hospitalization in there, the ICUs, the ventilators have to be in it. And that's what we look at every day to make those decisions. So as long as those numbers as a whole are pretty steady, then I think we move forward where we're at.
Some governors, and along with some city legislators, lawmakers, are deciding to put mask requirement into place. Do you foresee any future order from you to maybe put a mask ordinance in place for the state?
I do not. I do not plan to put an order in from the governor's office. Again, for people that live in those cities that want to live under those guidelines, that's their elected leaders' decisions. You know, I'm going to go back to what I said. Every day in this press briefing for I don't know how long, we tell you if you cannot keep the 6 feet in social distancing, to wear a mask. If you feel comfortable, wear a mask. I mean, again, everybody knows the situation out there. They know the risk categories right now that really a concern. I think you all got to, I mean, everybody has to keep that in mind and move forward, but no, I don't plan on mandating masks.
Hi, Governor.
Yes.
I haven't seen the budget yet, but just given all the conversations and the protests over the past few weeks, whatever it looks like for the Department of Public Safety, do you think it's sufficient to address the public's concerns about more accountability for police, how much police should be funded, things like that?
Yeah, well, I think on the Department of Public Safety, we're about as thin as you can be right now. I mean, we've had officers in the St. Louis region now for over a year that we're trying to help with the violent crime situation. We've got people in state agencies assigned to the task force. We're down officers in the Department of Corrections. Mental health is getting challenging every day to hire people. So, I mean, there's a lot of challenges out there. Public safety is no different. I mean, getting people to go into the law enforcement arena, I think, is going to be a real problem in the months to come. You know, so I think right now we are about as thin as we can be on public safety and corrections and mental health, and some of these real areas in the state right now are just critical needs that we got to keep moving forward on that.
Governor, you mentioned that you're going to be doing some travel on Thursday. Does that mean there's going to be a bill signing on Thursday as well?
Yeah, I'm not sure what my schedule is. Kelly will let you know on that, but I think we're going to be out some. I know I'm going to try to be out on 4th of July some this year to be back out, you know, and let me just say up front, I'm going to do the best I can to do social distancing when I'm out there. There'll be some gatherings at some places I'm going to go. I realize that, and we're going to take precautions for that. And
do you plan, just because you mentioned it, do you plan on wearing a mask when you are at those 4th of July festivities?
Most of them is going to be outside. It depends on whether they ask me to or not. I mean, everywhere that somebody's asked me to wear a mask, wherever that is in the state, I've always wore a mask. Me and the First Lady both. Whenever we go somewhere and people says, hey, we would like for you to wear a mask, we wear a mask, you know. Again, if it depends on what's outdoor facilities, it depends on where you do social distancing, you know. And I feel like, you know, in the position you know, I'm well aware of the situation. We'll try to make sure we keep that social distance as much as I can, but I don't plan on wearing a mask. Look, the mask deal has become a political issue in the media. I mean, it's driven by either you're on one side of it or you're not, and it's politically driven. Whether you wear a mask has nothing to do with Republicans or Democrat, whether it's a he-man or not, all of that kind of spin that everybody wants to put on it. You know, you have to make a decision as individuals to decide whether you're going to do that or not. You know the facts, whether to wear one or not. So if I was an employer and I wanted my employees to wear a mask, I'd ask them to wear a mask. If I wanted my customers, I would. If I don't, I wouldn't. And I think some of the freedoms that we all have in individual things have to be protected also for the everyday people out there also. The ones that don't want to wear a mask should have every right not to wear one if they don't feel like they want to wear one.
So you mentioned that everybody knows the facts on masking. I see online a lot of people seem to misunderstand which masks are effective and when they should be used. Is there any sort of effort from the government to try to get that information out there, you know, clearing the distinction between viral particles and droplets and that sort of thing so that people are actually informed and actually do know the facts?
Yeah, I think that's a good thing. Good point to bring up. And I would assume Dr. Williams is doing that. I don't want to put him in a box here, but I would assume that they're doing that because it is important to know how to wear a mask, which ones are safe and which ones are not. You know, I think people sometimes think, you see them all the time, people don't wear one over the nose. They wear one over the mouth, or they wear it up on top of their head. I mean, just different kinds of things. Again, you know, but people do need to know how you wear one properly if you're going to. I would think you would if you're going to wear one. But I think Dr. Williams, you have that on your site.
Yes, I approved it at about 1 o'clock. It's new, based on new information, and it'll be up this afternoon. I approved it at 1 o'clock.
So there's some new guidelines, new information. They approved it today, so they should have it on. But I would suggest go out there on CDC sites and find out the difference in the mask, because there is a lot of difference in that, and the medical profession will definitely tell you there's some differences there.
Jacqueline, final
Hey, Governor, just a quick update regarding the protests. Have you met with any more activists, or when do you plan to have your next meeting with them?
No, we haven't met with them. I met with St. Louis and Kansas City. I think were the last two we met with, and it's just scheduling when we get that done. But I told them I would, and we will. We'll meet with them. We'll meet with some of the clergy people again. We'll meet with some of the civic leaders. We're in constant communications. I guess I want to also say that with the mayors, county executive, local leaders, we had for about 17 weeks there. But we'll continue that dialogue. One of the things that you learn with experience, whether it's been in the Army, whether it's being the sheriff, whether it's being here in the governor at these briefings, communications is critical at a time like this. When you're going through tough times in your state, communications with people is a key. And the more that you can do before this ever happens, which we did, thank goodness, we're able to keep those communication lines open. Hey, look, everybody in this state is trying to do the best thing they can for the citizens out there. I firmly believe that to people I talk to.
Are there any tangible solutions that have been discussed yet?
Well, I think one of the things, I think you can look at some of the reforms. I think you're seeing a lot of agencies talking about reforms on how you do policing in the state. I don't know what the end result of that is. The legislatures will have an idea what to do with that. I think at a time when special session occurs, at some point that'll be a discussion in there somewhere. I know we're meeting with the African American caucus here in the next week or two, I think, to talk to them about some of their issues on that. But again, there's going to be discussions about that for ongoing. But I also think you ought to have every party at the table. This is not something that a city council, a mayor, a governor can sit down and do on his own. I think you need to have both sides of that. Law enforcement needs to have a seat at the table to discuss their views and what's safe and what's unsafe.
All right, thank you, Governor.
All right, thanks everybody. Appreciate everybody being here today. We'll see you Thursday again. Thank you.